No mystery behind the growing pressure on Canada's healthcare system. While the Omicron variant may be milder for vaccinated people, the sheer number of infections is still pushing up hospitalizations everywhere. Look at the increases in Ontario and Quebec today, with rising numbers in the ICU as well, all going up. Cases, but infected doctors and nurses are also being taken out of the mix. CTV's Heather Wright has the latest.
Nurses across the country are saying the same thing. They're burned out.
This is my 8th shift in a row. I need a day off. I can't work tomorrow physically and mentally. I'll make a mistake.
The fifth wave of the pandemic is straining workers and resources. In Quebec, more than 11,000 healthcare workers are off the job, either sick or in isolation. New Brunswick's top doctor has called the situation there a crisis in human resources, as hundreds of workers are off sick.
I can't tell you what tomorrow's going to look like. I can't tell you what next week is going to look like, but I can tell you that it's going to be a rough couple of weeks.
A code orange was declared at 2 hospitals in Ontario, allowing patients to be transferred and staff to be shifted between departments. A rise in new patients, coupled with sick staff, means demand for care is higher than what the hospitals can provide.
We're not being challenged with ICU pressures, and we're not being challenged with oxygen pressures or being intubated or being on a ventilator. It's just the sheer number of infections.
Even before the pandemic, hospitals were stretched. Canada ranks near the bottom of all OECD countries when it comes to the number of hospital beds per capita. And while many provinces have added more beds, staffing remains an issue.
At the end of the day, every patient needs a nurse, not just a bed to physically be in.
In Ontario, nurses are calling for a repeal of Bill 124, which limits salary increases to 1% a year to keep more people on the job.
Unfortunately, so many people are looking for an escape route out of this. And this is exactly why we're calling for urgent measures like, retention strategies as soon as possible.
More provinces are considering allowing COVID-positive workers to stay on the job as long as they're asymptomatic, while others say it's time to make it easier for internationally trained doctors and nurses to work here. Lisa.
Okay, Heather Wright on what's happening inside our hospitals.